Thanks to the complex iWorld, this is the second part of a four-part YouTube program. High priority issue number 1, pediatric polypharmacy. I've grown up on medication, reports 31-year-old patient J, medicated since age 14. I don't have a sense of who I am without it. Are too many drugs such a bad thing? Aren't options good? Isn't more better? Well, let's look at our iPod metaphor again. I grew up with a cassette Walkman, and it completely satisfied my needs when I was growing up as a teenager. But I could never go back now that I have an iPod. A single 90-minute cassette in a Walkman could be played from beginning to end, but one could not skip around. An iPod, on the other hand, can hold up to 40,000 songs. They can be played in any order, and they can even be shuffled. And most importantly, one can upgrade to a brand new and better iPod every single year. For those who were present in Dowling Auditorium in August, you would see my assortment of iPod products. I've purchased a new one every year since that very first one in 2001. I now have 4 different generations of the iPod Nano. I have a couple of shuffles, an original iPhone, and of course, an iPhone 3G. But perhaps so many options is not such a good thing with psychotropics. This paper by Zito and colleagues rocked the world, so to speak. It was published in JAMA in 2000 and got a lot of press. Zito examined prescription trends in 2 to 4-year-olds between the years 1991 and 1995. The authors did not look at what the diagnoses these preschoolers were given, nor who the prescribers were. The article contains several figures all showing the same steady upward trends. They only looked at prescription rates, and their bottom line, psychotropic medications prescribed for preschoolers increased dramatically. This was a study in 2 to 4-year-olds. This article made front-page headlines. It was featured in Newsweek, it was featured in Time magazine, and it prompted many public debates. Now, Zito was not the first to report these trends. A few others had done so earlier, but Zito's was the report that got noticed, and it even prompted a Frontline TV special, first aired in April of 2001, and then an updated version was aired in January of 2008. These are excellent and available online for free. They provide a fascinating window into the lives of families struggling with their newly medicated, and in some cases, over-medicated children. Kids and parents and school teachers and therapists and policymakers and pharmaceutical reps and many different other people are interviewed in these programs. What is most interesting hearing is how many families report how their child was started on one medication, usually at a very young age. Then another medication was added many months later to correct an adverse effect of the first medication, and then another medication is added a few months later to correct an adverse effect of the second medication, and the prescribing goes on and on and on. So why are we even talking about pediatric polypharmacy in this forum? Well, emergency department visits by patients using antipsychotic medications increased by over 800% in the last 10 years alone. The problem is only going to get worse, and we need to understand how we got to this point. Well, there are many reasons that have been proposed for why prescriptions are so liberally written today, especially for children. I think the answer is multifactorial, and here are some of the reasons floated in recent years. Some say patients and families are getting exactly what they want. As suggested by the Institute of Medicine's 2001 report, Crossing the Quality Chasm, we should now be working in an I-directed care model, a patient-directed care model, rather than the old provider-directed care model, because a patient-directed care model may actually reduce errors when the patients are involved in the healing process. Here's a direct quote from their report: "To provide care that is responsive to individual patient preferences." Now, this is one of the reasons why Press Ganey scores are so important to hospitals. These satisfaction scores are actually driving operational changes throughout the country. You know, a few recent studies show that patients are more likely to get what they want when they specifically ask for it. There are studies that show when patients specifically go to a doctor's office and ask for an antidepressant, they are likely to get what they've asked for. Now, we live in NASCAR nation. NASCAR is the #1 spectator sport in the United States. Look at the Wellbutrin ad right here. It should be no surprise that Wellbutrin prescriptions skyrocketed when number 18 started advertising that medication. Some say prescriptions are written so liberally now because it's only an American phenomenon. Americans want a quick fix and want to move on with their lives. but that has been shown to be not true. Studies done in other countries have shown the same trends elsewhere. Some say we're getting better at recognizing real pediatric psychiatric illness, and that is probably true. The MECA study, sponsored by the National Institute on Mental Health, used rigorous methodology to determine the prevalence of pediatric psychiatric illness in the last decade and found that 1 in 5 children or adolescents met the criteria for a psychiatric illness. They did not say 1 in 5 needed medication. They simply said 1 in 5 met the criteria for some kind of diagnosable illness. Now, the most concerning theory for the increased use of psychotropics in the last 10 years is that the definitions of psychiatric illness have changed significantly. And Joseph Biederman, who works at Mass General Hospital right down the street, has become the poster boy for that reason. He comes from an influential institution, and he has written hundreds of papers on pediatric bipolar disorder. Now, he's a polarizing individual in the psychiatric community because many do not think bipolar or schizophrenia can exist in the early childhood. But Biederman has staked his career on the claim that childhood mania exists, and more importantly, that its routine recognition and treatment not be delayed. Now, his name has been featured on the front page of many newspapers recently, and Frontline made it clear how he declined to be interviewed for their program. He has failed to disclose many of his consulting fees from pharmaceutical companies, particularly for medications he has studied and encouraged others to prescribe. The failure to disclose some of these relationships certainly taints the credibility of his research, especially if his research is indeed true. Some say it is because of Biederman that the diagnosis of bipolar in children increased 40-fold in the last 10 years. That's right, 40-fold. Now, I'm not here to criticize him specifically. I'm mentioning his name because it is important we all recognize why his name is being floated in the news and why the number of pediatric patients with bipolar disorder has increased so much in just 10 years alone. Now, are there long-term implications to using these medications? Patient J's doctor had not considered it until she brought it up. Now she was raising an equally fundamental question: how the drugs might have affected her psychological development and core identity. It was not an issue I had seriously considered before. Now, we all know the brain remodels and matures until young adulthood. We also know the preschool years are a particularly dynamic and vulnerable period for brain development. However, human data about these long-term complications is understandably lacking. So we have to turn to a few recent animal models that might help us understand. The first one comes from Columbia in New York, where young mice given fluoxetine transiently exhibited abnormal exploratory and stress response behavior as adults. The second study from Mississippi demonstrated impaired tryptophan hydroxylase expression after exposure to citalopram. For those who need a visual to help them understand, see the decreased cortical synaptic density when serotonergic pathways were briefly inhibited in a rodent model. Now, the story on long-term complications is to be continued. We still do not have enough human data in order to make conclusions, but these animal models already worry me that something needs to be done soon.